Today we had a really fun event. We partnered with a community partner of the Brain Center to host what we called Parkinson's Day, a move and learn.
So it was a great day of celebration for people with Parkinson's disease.
We try to get a bunch of different people from the community, different organizations.
So we started the day with a health fair. Our students led different stations involving different aspects of the patient's health.
We did music therapy, we did yoga, and then we're also ending with rock steady boxing. We had guest speakers come in.
They're here to participate, do activities, exercise. So initially it's all about their improvement on their motor skills. But something that really isn't appreciated as much until they start bringing up is really the social network that they build. They're the ones that really understand what they're going through.
At the same time, they love coming on campus. They love interacting with our students.
And we bring them on campus and we learn from each other. We learn from the patients and the patients learn from us.
Here they get to interact with actual patients and get to give back from what they're learning in our programs.
I enjoy the camaraderie, I enjoy the good workout, I enjoy the student support and the faculty support, and I feel like it protects me from progressing faster than if I didn't participate.
Overall, it really provides them this sense of being, right? A sense of, I have somewhere to go that I can battle this and not be on my own.